Because besides the breast cancer, I also had an opportunity to work with the head and neck cancer. I worked with those population very actively, and they have a trauma on a very different level. They can't talk, they cannot breathe, they cannot swallow. But same thing with our breast cancer population. There's besides, just the whole scarring is like breathing is difficult. Patients who are going through reconstruction can't even stand for more than 10 minutes at the beginning. And who knows what people, like their experiences have been before. And especially if somebody has a history of some form of trauma in the past, I think it accumulates with the diagnosis. So there's a trauma at different levels. So that really got me interested, and and just seeing like where I can help my patients more. I mean, I'm sure you have seen it in your practice to patients who are dealing with the second or third cancer, and they had some form of radiation surgery like 20 years ago, 10 years ago, and now there's a new one. And it's not the new spot which is bothering, it's the old spot which bothers. And they wonder like, oh, I always had something there, and you didn't know till they got connected. My background still helps me to deal with, like, especially when it comes to like the spiritual side. The spiritual aspect of it, because now I've been incorporating a lot of like the yoga based principles. So as like the little knowledge I have, I try to share with my patients, especially when I'm working with, like having them just like even opening up like coping skills, like leisure. Like now it becomes a goal for me in the first setting, like versus like, like, oh, I'm going to reduce your lymph, like arm growth size or dysfunction. I talk about what do you like to do, and then maybe help them go back to it to gain some sense of normalcy. So I think, in that respect, like that some of the yogic principles are helping me to help my patients to, help them deal with the change. So I think, yoga is one, breathing is one. I find foam rolling very, very helpful. But again, depends on, how comfortable they are to put it on their body. But just like, walking, just making sure that they can do a reciprocal walking, like just making sure that that's not stuck. So sometimes even that gets stuck when we are so stuck inside. There's a word of mouth which is going on in the community, or the doctor, knows, and they were somehow, somewhere I had impressed that doctor. They're like, go to her, that kind of thing. Or I am listed as a provider in their insurance. They can find me, but otherwise it becomes a big challenge, especially in the environment, the healthcare environment we are in. It's a big challenge. There's not many portals, at least reliable portals, which list providers. That even at the local level or the national level or a big state level, it does not provide that. Even American Cancer Society and stuff, they'll list the diagnosis, they'll list the side effects, but it does not list anything else, and there's no place for it.